And the features of the hepatitis C virus infection, this is important because the incubation period, while the average is 6 to 7 weeks, is important that it also can be from 2 to 26 weeks. So what do you think this means in practical terms? You're saying difficult to test when you have it, even more difficult since the symptoms are difficult to discern. That is absolutely true. So the incubation period means that the the antibodies would not develop for at least this amount of time. So if you're doing antibody testing to test for hepatitis C, there would be up to 26 weeks in which there was no antibody to test. So somebody could actively have hepatitis C and is highly virulent at that time, and you'll see a picture of that in a little bit. I think that's important for people to know, and that this incubation period also means that if you are just going to test with the antibody, you probably would not know for the period of time of the incubation. So as I've alluded to a few times, in acute hepatitis C, at least, even more than 70% are asymptomatic. And I mean asymptomatic in the sense that somebody would not know they had hepatitis. 20 to 30% may have mild jaundice, but it's very rare that somebody remembers ever having jaundice if they're only infected with hepatitis C. Now, sometimes people also have hepatitis B or hepatitis A, and so they might remember an instance of jaundice. There are some nonspecific symptoms, of course, of malaise, abdominal pain, anorexia, just like having the flu. So oftentimes when people have acute hepatitis C, they might think that they have a flu virus, and that would be it. And in fact, they have been infected with hepatitis C. Does anybody remember what fulminant acute hepatitis means? Acute liver failure. Acute liver failure. So basically, somebody goes into liver failure and can be very, very sick and often dies with fulminant acute hepatitis unless they're treated right away and the process is reversed. So very, very rare to have fulminant acute hepatitis when somebody only is infected with hepatitis C. However, if people have hepatitis C or hepatitis B, actually, here's an example. If somebody has pre-existing liver disease of some other sort, they could go into fulminant acute hepatitis, into acute liver failure. The reverse is more true, as if somebody has hepatitis C and then gets hepatitis A, approximately 40% go into fulminant acute hepatitis. Therefore, what does that mean in practice? What should people be doing who have hepatitis C? Yeah, get immunized to hepatitis A, for sure. Have the vaccine. I know there's a lot of controversy over vaccine. However, in this case, I can tell you that 40% possibility of fulminant liver failure definitely tells me that if someone has hepatitis C, they should be vaccinated against hepatitis A if they do not already have not already had it. Of course, if they have the antibody to hepatitis A, they can't get hepatitis A again. So the average time to seroconversion, so we have this incubation period of 6 to 7 weeks average, so the average time to seroconversion, of course, would be 8 to 9 weeks, because you have the virus for a period of time until the antibodies are developed and you seroconvert. So approximately 75 to 85% of people, depending on where you look at the statistics, have chronic infection with hepatitis C. And the development of chronic active liver disease used to be called chronic active liver disease, not so much anymore, but the chronic active liver disease is found in 60 to 70% of people with hepatitis C. So what does this mean? basically chronic or intermittent elevations in ALT and AST. But if you remember what I told you before, and you remember last week, that ALT and AST is not really that important in terms of liver function. So you can't really say it's chronic active liver disease in the sense of people having later stage disease. So it's more that there's a chronic inflammation that's going on with people with hepatitis C, may have elevated ALT and AST. So in terms of the clinical course, the medical terminology, of course, is insidious, meaning basically for a very long time, people can be asymptomatic or have non-specific symptomatology. Do you remember what one of the main, we're going to talk about it a little bit later, but what is the main symptom that people with hepatitis C that pretty much everybody experiences? Aaron and Thomas got fatigue. And so that's a non-specific symptom that, people could have with any number of diseases. And so it's, unless you have some reason to think someone has hepatitis C, that fatigue may not be obvious, that fatigue that someone has for many years is associated with hepatitis C. And even sometimes when people have hepatitis C and they are fatigued, normally it goes away if the virus is cleared, but not always. It's not always the case, so you can't always correlate it. So it's a non-specific symptom. Basically, finding the disease, a case finding, meaning finding out that someone has hepatitis C, is often not happens until somebody develops cirrhosis or symptoms develop. So this is one of the critical issues in hepatitis C for the fact that people are not generally tested for hepatitis C, that the cases of hepatitis C are found when people develop later stage disease or they develop symptoms that are associated with the hepatitis C, and it's often quite late in the process of disease. The number of people who develop cirrhosis over a 20 to 30 year period is around 10 to 20%, and now that there's been people who have had hepatitis C for much, much, much longer, we're starting to see up to 40%, 50% of people with cirrhosis. So when people come to me in the clinic and they say, "Oh, do I need to worry about this hepatitis C?" One of the things I want to ask them is, how long do they think they've had it? Now, not everybody can determine that, but there are some people who know that they've had it 20 years. Some people know they've had it 40 years. And that, in conjunction with the stage of liver disease, can tell us a tremendous amount. So anyway, that's just kind of a precursor of what we will talk more about. And we talked about last week, talking about cirrhosis and the development of cirrhosis. So sometimes somebody will come in, they're age 50, they've had hepatitis C for 20 years, they don't have cirrhosis. However, let's say they've been diagnosed, they have a biopsy, they've been diagnosed with stage 2 disease, and they ask me, "Hey, should I get treated for hepatitis C? What are the odds that I would die from it?" Well, there's a lot of questions. First place, I don't usually tell people whether I think they should be treated. I think that they need to figure that out and get all of the facts and decide whether they want to use a Western treatment or not. But I think that some of the facts that are important in this case, or let's say somebody's 50 years old, they've had it 20 years. Well, they haven't had it 30 years yet, and it's around 25, 30 years that more progression happens. So if they already have stage 2 at year 20, there's a pretty good likelihood that they're going to continue to have progression of liver disease. The other thing is, I usually ask people, well, what is your family longevity? Somebody tells me 70, everybody's died by the time they're 70, and there's much less likelihood that perhaps they should treat hepatitis C because they may or may not get cirrhosis by that time and will die from something else. But if everybody in their family has lived to be 95, here we got 45 more years, and it's pretty sure that they, 50 to 60 to 70% chance, or even more, that they will develop cirrhosis. So does this all make sense to people? Or anybody have any comments about this? It's pretty important because it's part of what we're doing when we're talking with people is helping people to figure out kind of what their overall response to having hepatitis C might be and having liver disease or not. So, if you remember what we talked about before, and I know you've been doing the reading at this point, that it's people with hepatitis C basically need to have cirrhosis in order to develop hepatocellular carcinoma. So you can see about 1 to 4% of all of the people who have hepatitis C develop hepatocellular carcinoma. So this means that of the 20% who have cirrhosis, about 20% develop hepatocellular carcinoma. It may be higher than that as time goes on, but that's something that we are learning more of the natural history of the disease. Yes, I was delineating 4 stages, stage 1, 2, 3, and 4. So cirrhosis being 4. It's interesting, I know that there's more than one system of staging. However, the system that's primarily used in hepatitis C, even though not in some other liver diseases, the primary system are the 4 stages. The primary people who use the 6 stages is the Department of Defense and the Army. But in the civilian hospitals, it's primarily the 4 stages. And we can review that more when we go through when we talk about biopsy and lab testing. So I want you to read that information because you should actually be able to read a biopsy report. And so when you see a biopsy report, and so that's a really good question, Anne, because when somebody comes to your clinic and they say to you, I have stage 4, you need to know if that's stage 4 of 4 or stage 4 of 6, because that's very different. So thanks for asking that question. So then their mortality from chronic liver disease is about 1 to 5% of all people with hepatitis C. So you can see it's not a huge percentage, but if you think of all the millions, hundreds of millions of people who have hepatitis C, it's a pretty large amount of the population. And it's a very expensive disease to have as well.